Good afternoon, faithful listeners and viewers of Equinoxe Radio Multimedia. It is with pleasure that we join you all on this edition of your program, You and Health, aired on Equinoxe Radio Multimedia. And for presentation, I am Esie Lucy Liengu. It remains a significant public health concern globally, including Cameroon, and according to the World Health Organization, in 2021, approximately 10.6 million people fell ill as a result of this health condition. Tuberculosis, which targets the lungs, can affect also the organs. On today's edition, we'll be looking at the causes of TB, prevention, and how it can be treated. With me here in the studio is a nurse from the Bingo Baptist Hospital here in the city of Douala. Good afternoon, MANGEH, Gladys, Leila.
Good afternoon, Sister Lucy. I'm glad to be here today. And as you've rightly said, I'm a nurse serving in the tuberculosis department in Bopi Baptist Hospital, Douala.
Yeah, thank you. It's a pleasure having you on today's edition.
The pleasure is equally mine.
And straight away, we'll be going to the first question. But before we go to the first question, for you who is just joining us now through your radio or your TV set, you have the following numbers to participate on today's program. We have 670547049, 670547049, or 656622222, 656622222 at the end. And back to you, nurse. We would like to find out, what is tuberculosis all about? When we hear of this term, it seems very broad. In a layman's understanding, what is this health condition all about?
Tuberculosis is an infectious disease and is contagious, affecting mostly the lungs. However, it can be treated. If the medications are taken normally, it can be cured. Tuberculosis can be active and it can't be latent. When we talk about active tuberculosis, it means that the individual is coughing actively, thereby spreading the bacilli into the atmosphere, and the individuals that are near that particular individual can easily inhale it because it is contagious. And so tuberculosis is being spread through air, and anyone that is at the near the person who is having the disease can likely take it.
Yeah. And can we talk more the mode of transmission? How is this disease transmitted from one person to another?
It is spread through air. If I am talking here and I have tuberculosis, you who is close to me, you will likely have it because it's spread through air. If I sneeze, I will likely give it to you. Or if I am talking and the droplets are being released into the atmosphere, you will likely take it because anyone near me, if I am having tuberculosis, is at risk. The cause actually is someone who is having tuberculosis, because what causes this germ is a very powerful germ, and the name is Mycobacterium tuberculosis. And so this one is the one that affects human beings. There is as well another one called Mycobacterium bovis. This one is found in cattle. And those who can take milk unpasteurized will likely have it, because when they take unpasteurized milk and they drink it, they will have tuberculosis. And so these are the means a human being can likely have it.
And we all know that when you have tuberculosis, the cough is somehow very intense than the usual cough we have. Let's talk more some of the symptoms that we have when we are facing this condition.
Yeah, there are diverse signs and symptoms of tuberculosis. However, the four cardinal signs are: there is cough. In the past, we used to depend only in coughing that is above 2 weeks. But it has recently been discovered that someone who is even just coughing for 2 days can likely have tuberculosis, because many a times when they come to the hospital, we say, can you produce sputum? Some people will say, no, I'm not coughing. But when we insist, they give the sputum and there it is. And so cough is one of them. We have also night sweat. Someone will say, but Douala is hot. How will I distinguish between the sweat related to TB and that related to heat? That of TB is intense, and you can end up even changing your linens. There is weight loss for those who have this tuberculosis. And so there is as well night sweat, like we've already said.
And now, how does this TB differ from other respiratory diseases? We all know that it affects our respiration. How does it differ from others that we all know?
The difference is, first of all, from the cause. Like I have said, the cause of tuberculosis is called Mycobacterium tuberculosis. Now, it is different from others because, one, the duration in a human being is going to be very long if it is left untreated. Now, the treatment takes 6 months, and for those who are fervently taking their treatment, it will take 6 months, but there are some people that become tired. You now realize that instead of taking 6 months, they will take more. But it will also depend on the site of the tuberculosis, because when it leaves your lungs and radiates maybe to your brain to form tuberculosis of the meninges, which means meningeal TB, you will take treatment for 12 months. Or if it comes to your spine, it can cause it can lead to paralysis. And so in that way, you have as well to take treatment for 12 months. And so tuberculosis treatment will depend on the site. Generally, if it is only about the lungs, it will take you 6 months.
All right. For those who are watching, you would like to participate. Maybe you're having this disturbing condition, you're facing an intense cough or a chronic cough that is maybe when you're taking medications, it doesn't really subside. This is the time for you to ask your questions, ask your worries. We have 6705470049, 6705470049, or you can join us via 65662 2222, 65662 2222. And back to you, nurse. You are a serving nurse or a TB nurse at the Mbopi Baptist Hospital. Tell us approximately what is the statistics of tuberculosis cases at the Bingo Baptist Hospital?
Okay, in Mbopi Baptist Hospital, I'll vividly give what we've generated as a statistic since the year 2023. I will also give it for the littoral region as well as Cameroon. In 2023, we had 351 people that were placed on treatment. And in the general littoral, we had 5,375 patients. Cameroon as a whole, we had 25,705. In 2024, we had 325 cases placed in treatment in Mbopi Baptist Hospital. In the littoral region, we had 5,353. And Cameroon as a whole, we had 27,153. Now, in 2025, this is just the first trimester of this year, 2025, we are having 76, which means from January to March. Now, in littoral, we have generated 1,349. But in Cameroon, we are having 6,824 patients that have been put on treatment. And it will be good for you to know that these are just the people that have come to the healthcare delivery system and have been diagnosed with tuberculosis. There are some lingering out there because they don't truly know that tuberculosis exists. They don't as well know that these are the signs and symptoms. So when we are here, we really want people to understand that it is not only waiting to be coughing seriously before you come to the hospital. You can still be coughing actively, but you don't have tuberculosis because there are some kind of coughs as well, like pneumonia. With that pneumonia, it is also very hard. When you're coughing, you have pains in your chest. The pains is related to the tightness of the sputum occupying your alveoli. And so when you want to compare the cough of pneumonia to the cough of tuberculosis, you see with pneumonia it comes suddenly. And with tuberculosis, it takes time. Tuberculosis, you will be having it even as a latent tuberculosis for some times. But when the immune system breaks down, then it will actively get up. But with the others, it comes and within 2 weeks, you find it manifesting. And with the others, they can easily subside. Or they can subside with antibiotics. But with tuberculosis, it doesn't subside like that.
All right. when we look at the statistics, we find out that they are increasing, or they are high. So how can the BCG vaccines help to prevent this pathology in the country?
As far as BCG vaccine is concerned, it is given to children that have just been delivered. These children are considered people who have not yet been exposed to tuberculosis because they were in utero. So as they are coming out into the tuberculosis infested zone, they are supposed to take their BCG because they have not yet been exposed. But for me and you that are moving in the tuberculosis infested zone, BCG may not be very useful for us because we have been exposed. I go to church, I go to the market, I enter taxis, and I am a nurse dealing with patients from all diverse form of life, and so I'm exposed already, which means tuberculosis may not be very useful for me again. BCG itself is tuberculosis that has been made weakened and then introduced into your system to be able to develop a system to fight against tuberculosis when it shall be coming. Now, however, if I am already exposed and you give me BCG, it will not help me. And if the load of the bacteria in me is so high, it may instead cause me to have tuberculosis because it's just a weakened tuberculosis that has been injected into me. But it's very good for children that are just being delivered.
All right. At what level should we be worried? Let me say we have cough, intense cough for 1, 2, 3 days. At what level should we say, no, this is getting out of hand, let me visit the hospital?
Okay, normally if you are coughing, you should come to the hospital. In the hospital, what we should first of all know is that these cardinal signs and symptoms which are for has really made us to know that if you have any of them, do not suspect again anything, just suspect first of all tuberculosis, which means if you have had your treatment in your health center and maybe for 5 days to 2 weeks and you are not getting better, please, I advise you to go and give your sputum so that it can be checked. Because if it is not checked, you will keep buying the drugs, and then as you are consuming the drugs, it will not help you. It doesn't help you because the drug you are buying is not the right drug, it's not the right treatment for tuberculosis. So that is what you should do if you've taken for 2 weeks and you are not able to get well.
When we get to the hospital, what tests are supposed to be done in order to diagnose the disease?
There are different tests in the hospital milieu that are responsible for testing tuberculosis. And the first test is called Zil-Nelson. In this test, you are supposed to produce your sputum. When sputum is taken now from you, it is smeared. When it is smeared, it is washed under the microscope to be able to see the bacilli. If it doesn't prove positive, we can still use that very sputum to check on gene expert, because gene expert captures better than Zil-Nelson. And if gene expert still doesn't capture it, we will still do culture. However, there are as well X-ray machines that will be able to diagnose whether you have cavities. There are also some cases that even though Zil-Nelson has been done, gene expert has been done, and cultures have been done, yet we cannot see. But depending on doctors' discretion, they will still put you as a SME-negative pulmonary TB case or an extra pulmonary case so that you can be able to have your treatment. And in such cases, you realize that when the patient is starting on treatment, the person will quickly get well.
And now we are in the hospital. We have gone for the test. Maybe medications have been written. How long can the TB treatment last? How long?
Like I said, the TB treatment will last depending on where the tuberculosis is. The first thing I said is tuberculosis is found in the lungs. Now, if care is not being taken, that is diagnosed actively.
Yeah, continue.
Yeah. you will now see that it has spreaded into your brain. When it spreads to the brain, it becomes extrapulmonary TB. And in that case, now you take your treatment for 12 months. Or if it goes to the spinal cord, you will take treatment for 12 months. But if it is just limited within your lungs and to other sites, you will take your treatment for 6 months.
Can this treatment be followed traditionally or just at the level of the hospital?
It cannot be followed traditionally. However, there are some patients that when they are tired of taking their treatment, they will tell you that, no, I'm going for a traditional doctor to treat me, just because they want to run away from the long-term treatment. But no traditional treatment as of now have really come up to the hospital to prove to us that, yes, give this patient that has been diagnosed so that we can be able to treat.
Briefly, let's talk about the side effects of some of the medications when it concerns the treatment of TB.
Yes, there are really side effects from this medication. The first side effect is there is a blurred vision. When some patients start taking it, they will be affected by blurred vision, and that is one of the reasons why they stop taking it. Some become very tired, and they manifest as well with generalized body pains. And there are also some patients that will be complaining of numbness or tingling sensation of the extremities, and all these are related to the side effects of the tuberculosis.
Any last word for our listeners and viewers before we go?
Before we go, I would like to advise our listeners that it's always good that if you suspect yourself of having tuberculosis, come so that you can be tested and treated. And if you've been tested and diagnosed that you have, it's good to collect your drugs, take your treatment for 6 months. And if you want to cough, please, there's no need coughing on your hands. Always use your elbows, and you cover your mouth, and use the right cough etiquette so that you don't keep spreading tuberculosis. And one thing is, children are highly exposed to this tuberculosis because no one cares to ask the child whether to take him or not. And since their immune systems too are very weak, any person entering a compound just picks the child up and start kissing the child. You don't have the guts to really ask that, how is your mother, how is your situation, are you having tuberculosis? To the extent that some of these children now are being infected just because of less care that is granted to the children. And so I would advise that if you're having your child less than 5 years, please, it's not just very important to give your child to anybody. You have to take great care of your child. And wash your hands. Always make sure you wash your hands, and move with your alcohol, hand sanitizer wherever you go.
All right, thank you very much, Nurse Gladys Leila, for being our guest today. Thank you.
Thank you so much.
Hope to have you next time again.
All
right, that was Nurse Gladys Leila, nurse serving, a TB nurse to be precise, serving at the Bopi Baptist Hospital here in the city of Douala. Ladies and gentlemen, we have come to the end of this edition of your program You and Heard on air on Equinoxe Radio Multimedia, and for presentation I have been Esia Lucilengu. At the technical dashboard we had Louis Pego and Jonathan Babiola. Do stay in the company of interesting programs on Equinoxe Radio and Show Television.